Welcome to this analysis of public sector leadership, focusing on Dr. Francis Collins' tenure as Director of the National Institutes of Health. Today, we'll examine how his administrative leadership transformed America's primary biomedical research agency and shaped public health policy during critical periods, including the COVID-19 pandemic. Our analysis will explore four key dimensions of Dr. Collins' leadership. First, we'll examine the leadership domain, including NIH's organizational context and Collins' background. Second, we'll analyze his approach to policy, personnel, and program management. Third, we'll evaluate his organizational and leadership style, and finally, we'll present a case study demonstrating his leadership in action during the COVID-19 crisis.
Let's begin with Section 1, the leadership domain. Here, we'll explore the organizational structure of NIH, Dr. Collins' biographical information, and the leadership context in which he operated. This foundation will help us understand the environment that shaped his leadership strategies.
People are what hospitals are all about. In this respect, the clinical center here at the National Institutes of Health is much like other large urban medical centers. Our patients are diverse. They may have cancer, heart disease, diabetes, or less common disorders such as lupus erythematosus. Each of our patients is admitted for a specific research study. In this respect, the clinical center is unique. In caring for these patients, swift, efficient communication is essential, so treatment can progress smoothly, accurately, and professionally. Along with patient care, more than 2,400 medical research programs are being carried out by 12 institutes. This generates an extraordinary outpouring of patient data, which must be stored in a form which makes subsequent retrieval and analysis as efficient as possible. Patient care, communication, and research. How do we bring it all together? That's what MIS is all about.
The National Institutes of Health represents the cornerstone of American biomedical research. As the world's largest public funder of biomedical research, NIH manages an annual budget exceeding $41.7 billion. The organization encompasses 27 specialized institutes and centers, coordinating over 50,000 research grants annually. This massive scale underscores the complexity of the organization Collins was chosen to lead. Dr. Collins brings exceptional academic and professional credentials to his leadership role. His educational background combines scientific expertise with medical training, holding a PhD in physical chemistry from Yale and an MD from the University of North Carolina. Before becoming NIH director in 2009, he served as director of the National Human Genome Research Institute for 15 years, where he successfully led the Human Genome Project to completion. This combination of scientific achievement and administration experience made him uniquely qualified to lead NIH.
The context of Collins' leadership at NIH was defined by unprecedented challenges and opportunities. He managed an organization with over 20,000 employees while coordinating research across thousands of institutions nationwide. During his tenure, he faced evolving public health challenges, including the opioid crisis and ultimately the COVID-19 pandemic. This environment required balancing scientific priorities with public health needs, while navigating complex political and funding landscapes.
I had a fascinating day today at Nationwide. The main focus of my visit was actually about the opioid crisis, and I learned a lot about the research that's going on here. A lot of people who come to a pediatric hospital, those kids are still looking for answers. I think what's happening here is pretty inspiring. A large hospital that sees lots and lots of pediatric patients, but has built a research capability that is very tightly integrated with that. That's how we make progress in medical research, having the people who are doing the research right next door, right here in this building. And you can see the facets of that have so many of us really fired up and excited. The floor we're on right now has this incredible genomic sequencing capability. This is, in many ways, the hottest part of what's happening in pediatrics and in adult medicine. Nationwide is really in a wonderful place here to be out on the leading edge of that. Nationwide is one of the centers that we at NIH are counting on as part of a national clinical trial network to try to understand what is the best way to prevent the consequences of opioid addiction. And that's a very tough challenge, and very few places have a facility that can handle that kind of circumstance. It takes a research institution like this to be able to try out those possibilities, see what works, and then spread the word to the rest of the nation.
Moving to Section 2, we'll examine Collins' approach to policy, personnel, and program management. This section reveals how his leadership philosophy translated into concrete actions and initiatives that transformed NIH's operations and impact.
Collins implemented several transformative policies during his tenure. He revolutionized research funding approaches through initiatives like the Brain Initiative and the Cancer Moonshot. His emphasis on precision medicine led to the groundbreaking All of Us research program. During the COVID-19 crisis, he demonstrated remarkable adaptability, rapidly implementing policies to accelerate vaccine development while maintaining scientific rigor.
Precision Medicine Initiative is going to give us insights into individual differences that are critical for improving the likelihood of good outcomes, to keep people healthy, or if you develop a chronic disease, how to manage that in a way that gives the best possible result. Not in a generic way, but for you as an individual.
In personnel leadership, Collins emphasized developing the scientific workforce while promoting diversity and inclusion. He established programs to support early career scientists and implemented initiatives to increase representation in biomedical research. His approach fostered collaboration across institutes and disciplines, breaking down traditional silos within the organization.
Science can sometimes get a little lost in the details. The average scientific experiment fails. The average project is pretty into the nitty-gritty. It's not impossible for people to sort of lose the vision if it's not brought back to their attention. That's one of the tasks of the leader, is to say, you guys are doing great work. You just came up with this new observation about this new thing that nobody knew before. But let's step back a minute and say, why are we all here? What is this about? Science is this glorious adventure into the unknown, the opportunity to discover things that nobody knew before. And that's just an experience not to be missed. But it's also a motivated effort to try to help humankind. And maybe that is just by increasing knowledge, because that's a way to make us a nobler species. But maybe it's also to come up with something that will have a practical benefit. And for me as a physician, a lot of the motivation for science is that it ought to do something for human health. But we can get lost in the details and forget that that's what it's about. Certainly that's one of the roles a leader needs to play, especially if things are kind of not going very well. People are frustrated and the experiments haven't worked, or the answer wasn't the one you wanted. Your hypothesis turned out to be wrong. Or, your test tubes fell on the floor, or whatever it is, to sort of say, wait a minute, remember? We're really lucky here. We get to do this. We are engaged in a noble enterprise to discover the truth. What an amazing experience to be able to spend your life that way, and especially to see how this might help somebody. That's part of what the leader has to do. Remind you when you're a little bit distracted by the infinite details that what you're really doing is something special, something that probably throughout the course of history very few people have been given the privilege of doing.
Collins' program implementation strategy focused on addressing major public health challenges through coordinated research efforts. The All of Us research program aims to gather data from 1 million Americans to advance precision medicine. The HEAL initiative addresses the opioid crisis through comprehensive research. His involvement in Operation Warp Speed demonstrated his ability to mobilize resources for urgent public health needs.
I'd like to talk a little bit more of the Trump administration. Mask wearing aside, what did they get right?
The Operation Warp Speed, for which I give a great deal of credit to Secretary Azar, was an effort that many of us were not initially convinced was going to be necessary. And it was thought about as a Manhattan Project. Those words were used sometimes to describe what needed to happen. In order to get all parts of the government together in an unprecedented way to test up to 6 vaccines in rigorous trials, and to do this at-risk manufacturing, so that if any of those trials happened to work, you would already have doses ready to go into arms. That would not be the way things are traditionally done. That effort and the recruitment of Dr. Moncef Slaoui was an incredibly important step forward that the administration deserves credit for, because that did motivate a lot of actions, a lot of coordination. The fact that we, in December, had not 1 but 2 vaccines that had gone through trials of at least 30,000 participants and had been judged safe and effective by a very rigorous and very public FDA process is just breathtaking. That got done in 11 months from when we first knew about this virus is at least 5 years faster than it's ever been done before.
Section 3 examines Collins' organizational and leadership styles. Here we'll analyze how his personal leadership philosophy shaped NIH's culture and operations.
Collins' leadership philosophy centered on evidence-based decision-making while emphasizing ethical considerations. He maintained a strong commitment to public engagement, regularly communicating complex scientific information to diverse audiences. His collaborative approach fostered partnerships across government agencies, academic institutions, and private industry.
Hi, I'm Francis Collins. I'm the director of the National Institutes of Health in the United States. The question I've chosen is, please tell us what you care about, what future direction you seek, and how you will contribute to improving the state of the world. This is from Alain Wouters of Facebook. Well, I'm a physician, and it's part of my job as the director of the NIH to try to oversee biomedical research in the largest institution that supports that in the world. And one of my major hopes is that these advances in medicine, which are coming quite quickly, will in fact not just benefit the wealthy, but all the peoples of the world. And Davos is a place where we come together to talk about that. We are making great strides in terms of understanding the causes of infectious diseases. But in particular here this year, we're talking a lot about non-communicable diseases, diabetes, heart disease, obesity, cancer, which are becoming more and more common and are now the major causes of morbidity and mortality across the world. And what can we do about those things? Well, many things could be done and should be done, beginning with tobacco, which is the cause of a very great deal of suffering across the world. in which we as a world have so far failed to completely face up to and develop a plan to try to prevent those kinds of preventable outcomes. Many other things, though. We need to deal with the issue of infectious diseases. We right now are facing a particular challenge about influenza. Is it possible that the bird flu may find its way into the human population? Many discussions about the appropriate ethical boundaries on research to look at that, because one would like to know answers, but also keep people safe. So my hope would be that through the process of medical research leading to advances in preventing suffering and death, we could all agree on it. All the peoples of the world, all the faiths of the world seem to have in common the desire to try to do that sort of thing, to keep people from suffering unnecessarily. Davos is a place where we can focus on those things, make some progress. If I can contribute to that in a small way, then I'll feel as if my time here on Earth is well spent.
His organizational management style emphasized flexibility and coordination across NIH's diverse institutes. Collins implemented a matrix structure that facilitated cross-institute collaboration while maintaining each institute's distinct mission. He expanded international partnerships and strengthened public-private collaborations, maximizing NIH's research impact.
Our final section presents a case study of Collins' leadership during the COVID-19 pandemic, demonstrating how his leadership principles operated under extreme pressure.
China has identified the cause of the mysterious new virus. Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation where there is not a cause for alarm.
The first US case has been detected.
There's confirmation the coronavirus has reached Australia.
China is urging its citizens not to travel abroad as it struggles to contain the virus.
We will be standing up Christmas Island as a quarantine area.
Foreign nationals coming from China are now banned from entering the country.
I have today declared that the coronavirus presents a public health emergency in the United States.
Trying to contain a city of 11 million people is new to science. It has not been tried before as a public health measure.
The death toll now has risen above that of the SARS outbreak 17 years ago.
We now have a name for the disease, COVID-19.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
The Italian government tonight put the entire country on lockdown.
COVID-19 can be characterized as a pandemic.
We will be suspending all travel from Europe.
From Italy this evening, it just gets worse. The death toll now worse than China.
What happened in Bondi was unacceptable.
12 years of perfect employment, it all blows up in 24 hours.
More than 3 billion people in almost 70 countries and territories have been asked to stay at home.
From this evening, I must give the British people a very simple instruction. You must stay at home.
We're asking everyone to work at home if possible, postpone unnecessary travel.
आज रात 12 बजे से संपूर्ण देश में.
So together, and with the rest of the world, we face this unprecedented challenge. For many, young and old, 2020 will be the toughest year of our lives.
We've got some breaking news to bring you, and it's to do with the Prince of Wales. He has tested positive for coronavirus.
The Prime Minister, Boris Johnson, has tested positive for coronavirus.
Countries around the world have now reported more than 1 million coronavirus cases.
Prime Minister Boris Johnson has been transferred to the intensive care unit.
The city may have to temporarily bury bodies on public land if they run out of morgue space.
Better days will return. We will be with our friends again. We will be with our families again. We will meet again.
In January 2020, Collins faced what would become the defining challenge of his NIH leadership tenure. The emergence of SARS-CoV-2 presented an unprecedented threat to global public health, requiring immediate and coordinated action from the nation's premier medical research institution. Collins confronted three critical challenges simultaneously. First, the urgent need to understand a novel pathogen about which little was known. Second, the imperative to develop effective treatments and vaccines at unprecedented speed. Third, the necessity of maintaining scientific integrity while operating under intense public and political pressure. The scale of this challenge was extraordinary. NIH needed to mobilize its entire research infrastructure, coordinate with multiple federal agencies, engage private sector partners, and maintain transparency with Congress and the public. Collins' previous experience leading large-scale scientific initiatives, particularly with the Human Genome Project, proved invaluable in this moment. Within weeks, he had established emergency response protocols and research priorities that would guide NIH's pandemic response. Dr. Collins' response to the pandemic exemplified strategic public sector leadership at its finest. His first action was establishing the Accelerating COVID-19 Therapeutic Interventions and Vaccines Partnership, an extraordinary collaboration bringing together over 20 biopharmaceutical companies, multiple federal agencies, and the European Medicines Agency. This unprecedented public-private partnership demonstrated Collins' ability to transcend traditional bureaucratic boundaries in pursuit of public health goals. Under his direction, NIH implemented innovative funding mechanisms to accelerate research while maintaining scientific standards. The RADx initiative, launched in April 2020, revolutionized diagnostic testing development through a Shark Tank-style selection process. Collins personally oversaw the coordination of vaccine development efforts, working closely with Operation Warp Speed, while ensuring that scientific integrity wasn't compromised by political pressures. Perhaps most notably, Collins maintained remarkable transparency throughout the crisis. He instituted regular briefings with Congress, appeared frequently in media interviews, and established clear communication channels with the scientific community. This commitment to open communication helped maintain public trust during a period of intense uncertainty and misinformation. The results of Collins' leadership during the pandemic were extraordinary by any measure. Under his guidance, NIH contributed to the development and testing of multiple COVID-19 vaccines in less than a year, an achievement previously thought impossible. The ACTIV partnership evaluated over 800 therapeutic agents, leading to multiple successful treatments. The RADx initiative supported the development of more than 150 diagnostic tests, fundamentally transforming our testing capabilities. But beyond these tangible achievements, Collins' leadership during the crisis offers enduring lessons for public sector administration. First, his ability to balance competing demands, which were speed versus safety, scientific rigor versus urgent need, public communication versus technical accuracy. These demonstrated the importance of principled leadership in crisis situations. Second, his success in fostering unprecedented collaboration showed how effective public leadership can break down traditional institutional barriers when necessary. Finally, his maintenance of scientific integrity, despite intense political pressure, illustrated the crucial role of independent agency leadership in preserving public trust. The COVID-19 response represents a masterclass in public sector crisis management, demonstrating how strong leadership can mobilize institutional resources to serve the public good, even under extreme circumstances. These lessons will inform public administration practice long after the pandemic has passed. Dr. Francis Collins' 12-year tenure as NIH director represents a transformative period in public sector healthcare administration. His leadership demonstrates how effective public administration can advance scientific discovery while serving the public good. Through strategic vision and principled leadership, Collins transformed America's largest biomedical research institution while navigating unprecedented challenges. His administration and impact extends far beyond scientific programs or initiatives. Collins revolutionized how federal agencies can collaborate with private industry while maintaining public trust and scientific integrity. His leadership through the COVID-19 pandemic demonstrated how public institutions can respond to global crises through effective administration and clear communication. Perhaps most significantly, Collins established a new model for public sector scientific leadership. By combining rigorous scientific standards with innovative administrative approaches, he showed how government agencies can accelerate scientific progress while maintaining public accountability. His emphasis on diversity, ethical conduct, and public engagement created lasting challenges in how NIH approached its mission. As we look to the future of public health administration, Collins' legacy provides valuable lessons for public sector leaders. His success in managing complex organizations, fostering collaboration, and maintaining scientific integrity while serving the public offers a blueprint for effective public administration in the 21st century.